Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. All right. Good evening, everyone, and welcome to another episode of Telehealth Tuesday, your go-to podcast for insights on modern healthcare and wellness solutions. I'm Dr. Michael Bookhardt, your host, and today we have a very special episode lined up just for you. But before we go to that, for all the residents here of Jackson, Mississippi, who are experiencing issues with the storm, our thoughts and prayers go out to you. Hopefully you and your families are safe and no harm has come to anyone. So again, our thoughts and prayers go out to all the citizens here in the Mississippi and surrounding areas and cities and even states. Also, I'd like to let you know that Telehealth Tuesday can be viewed on multiple platforms, including our YouTube channel, which is Dr. B TV. That's the word doctor spelled out, DOCTOR, the letter B as in boy, TV, and also our other pages on Instagram and Facebook, respectively. Please follow, like, share, and subscribe. Don't forget to subscribe to help support this amazing program. Now, before we get started, let me tell you about our next guest. I got to sit up straight for this one. I see we got a few people already. Y'all come on in. Look, our next guest, Dr. Sharmon Robinson, is a physical therapist who has been practicing for 11 years. Dr. Robinson completed her bachelor's degree in kinesiology at Mississippi State University and also her doctorate of physical therapy from Arkansas State University. She's a product of Jackson, Mississippi, homegrown, which she returned home in 2021 to open In Touch Physical Therapy. ITPT, as it's better known, is an outpatient clinic that services the Jackson metropolitan area, and she's treating musculoskeletal diagnosis with a diverse mixture of neurological and vestibular conditions. Dr. Robinson has an array of experience in the outpatient clinical setting and also in the hospital setting. Her passion lies in the outpatient clinical setting, and she also wants to make sure that you know that she's a hands-on physical therapist who is compassionate about serving her hometown community and providing premier physical therapy services to all that are in need. And her motto is, all you need is a touch. So ladies and gentlemen, without further ado, let me introduce to you Dr. Sharmon Robinson. Give it to her. Give it to her.
Thank you for having me.
All right. Thank you for being on with us. I hope we did you justice. We try to bring you out now. We bring you out.
You did a great, exceptional job. Thank you.
Awesome. How are you feeling tonight?
Feeling great. Happy to be here and part of your Telehealth Tuesday.
Wonderful, wonderful. And actually, I know that you just had a birthday. Is that right?
Yes, I did. Thank you.
All right. 25, 21. Huh?
Yeah, that's what we're going to go with. Exactly. I feel 25.
All right. Well, that sounds amazing. Are you? Is everything okay where you are? Are you safe over there?
Yes, sir. I'm safe and all is well. Thank you.
Awesome. Well, is there anything that we missed in your bio and introducing you to everyone? Is there anything we missed that you'd like for people to know about you?
You pretty much covered it all. I would just say I'm just a down home Jacktown girl, and I really have a heart for my community, and I just kind of like LeBron brought his talents back to Ohio. I want to bring my talents back to Jackson and just be the positive impact in a community. With sometimes I know Jackson can get a negative rep with so much going on, but I'm just happy to be a part of something that's greater than myself and servicing the community that made me. So.
Absolutely. And you know what, speaking of that, and speaking of King James there, what made you come back to Jackson? We read in your bio that you obtained your doctorate at Arkansas State. So what actually made you come back to Jackson to home?
That's a good question. After graduate school, I kind of bounced around in different states, lived in Texas, Alabama, and the last stop I was in Memphis was the last job I worked prior to having my business. And I incurred a lot of challenges in terms of just trying to navigate working for a company and with a lot of demands. I was really stretched as a therapist, and it kind of got to the point where I had to make a decision if I was just going to separate from the company, in which I ultimately did. And everything, the cards just aligned, and it just I took a sabbatical and I did some soul searching, and I'm a woman of faith and a lot of praying, and I feel like God just led me to start my own. And I couldn't see myself doing it nowhere but where I grew up, because a lot of times it's called the brain drain in Jackson, where people get educated and they move out because more opportunities outside of Mississippi. However, I wanted to come back to Jackson and just have my business here and really like be part of something that's just bigger than me. And so that's essentially what led me into being a business owner.
Well, yeah, amen to that. So, before we get started with some of our prepared questions, as you all know, this is live. So, ladies and gentlemen, and to all that are here, I see several people have joined. I know they're excited about our talk with Dr. Robinson tonight. I see Jasmine Briscoe saying she's got to come. Do you know Jasmine?
Think so. She looks familiar. I'm sorry, this light is blinding me, so I can't.
Oh, yeah. Well, yeah, Jasmine is um, look, now Jasmine, don't get on me too bad, but Jasmine, she she said, bless. Jasmine is a woman of many talents. We've had her on the show before when we did a show with Dr. North, who's a plastic surgeon here, and we had Jasmine Briscoe on. She is a licensed massage therapist, and she makes sure to put her LMT number on her business card, and everywhere she goes, I think I memorized it. It's like 845. No, I'm just kidding. But Jasmine is an amazing massage therapist. Has different techniques, and she's also a lymphatic drainage expert. But so she's done some great work in the area. Anyway, um, let's talk about this. So you wanted to come back to Jackson. Tell us about the differences, like in practicing in your field in Jackson compared to Memphis or Arkansas and different places. Do you find that there's a difference in the patient population?
I wouldn't say there's necessarily a difference in population. I mean, of course, if you're looking at some of the bigger cities, you probably get more diversity with cultures, but for the most part, it's essentially about the same. But it's just the role just shifted. Like I went just from being like like a lead PT of a clinic to being the owner. So that's more so was shifted. But the patient care side, the demographic is I would say is about the same for sure as all other places that I practiced.
Okay, okay, awesome. And one of the things is let's get right to the nitty gritty of it. When we see on your credentials DPT, what exactly, because everybody out there, those of us that are in healthcare, certainly, we're familiar with physical therapists, but what exactly is a physical therapist and what type of services do you offer to patients?
Okay, so not to be confused, I always like to use this disclaimer. It's a clinical doctorate of physical therapy. So no, we don't have the medical doctor title. We have a clinical doctorate of physical therapy, which a lot of it was just research based. And so initially back in the day it was bachelor's, then it transitioned to master's, and then to a clinical doctorate. So I like to make that distinction. And I apologize. What was the latter part of that question?
Oh, just letting everyone know what exactly is a physical therapist and what services you offer.
Yeah, so a physical therapist is oftentimes misconstrued with a massage therapist or a personal trainer, which are both great, careers for sure. But we are licensed by a board, a governing body in each state, where we to be a physical therapist, you have to have a bachelor's degree, and then, like I said, that clinical doctorate degree. And what we do is we evaluate and treat different. Diagnoses that cause mobility issues or pain, restrictions and like joints, all that type of thing. So It's very detailed. People don't understand. We do go to school for 7 years total, 4 years bachelor's if you finish in four, then 3 years of DPT. So just years shy of compared to some medical doctors. But it's a very intense program, and we learn everything about the human body, and we are the experts in like mobility, special musculoskeletal conditions, and treating neurological, vestibular, and just general some cardiac stuff too. So it's all about like more so rehab. We do have preventative aspects of our career, but we're more of a rehabilitative career where we're helping someone bounce back from injuries, any kind of physiological manifestations, body events, all kind of complex phenomenons happen with the body that can impair mobility. So we're just here trying to restore movement, and it can be on a basic level, it can be on an athletic level. It's so many different avenues.
Awesome, awesome. And what would you say are some of the common misconceptions or misunderstandings that people? I know you talked about there's confusion with massage therapists and trainers and things like that. So, are there any other misconceptions or misunderstandings, that you run into in your field?
Yeah, for sure. I think it's a lot of people have an outdated kind of view, and it just could be from just a lack of knowing what physical therapy is. But a lot of times, people just think we're just like glorified personal trainers, where we're just going to kill you and just exercise you. But
Mm,
depending on what setting you practice in, hospital versus clinic versus skilled nursing facility or inpatient rehab, it's going to be a very detailed rehabilitative approach for the whole person. Yes, exercise is part of what we do, but it's not the only thing that we do. Our skill set is such, it's more diversity than just what was thought to be exercise alone, like back in the day.
awesome. I see Jasmine is saying it much needed. Jasmine, we haven't seen you for a few episodes, so she normally has some interesting questions, or she's always going to place some comments on there. And she normally is going to ask a question related to massage therapy or lymphatic drainage. So we're ready for you, Jasmine. Okay. And again, to those that are just joining us, I see we've got a couple of new people that have just come on in. So again, welcome to. Oh, yeah, there she go. Can you see the comments, Doctor?
Yeah, I can see them. Thank you for your comments, Miss Jasmine. And that's true
Yeah.
too. They do confuse us with chiropractic work as well, although there's some similarities, but two different career paths. So
Absolutely. Well, for those that are just joining us, thank you for joining another episode of Telehealth Tuesday. This is your go to podcast for insights on all things medical and then some. And we want to let you know that we are a live show. And so we are certainly taking questions, comments, concerns. So please, we have Dr. Sharmon Robinson here, a local physical therapist who has her own practice right here in this city, Jackson/Flowood. She also has a hospital practice. So if you guys are suffering from back pain, chronic issues, and all types of other ailments, please make sure to ask your questions and make comments right here, because she's here to talk to you. She's here to answer those. I know that back pain used to be the number one cause for visiting the doctor, the family medicine doctor, several years ago, and it's still certainly in the top three. So, all right. So let's talk more about that, Dr. Robinson. Let's see. So we talked about the misconceptions and things that people get, misconstrued, as you said. What about, how do you approach creating an individualized treatment plan for each patient? Like how does that work when they come into In Touch Physical Therapy, the individualized treatment plan? Walk us through that. How does that work?
I'm gonna preface this by saying I learned in school from one of the greatest professors of all time, Penny Head. She said, "Do not be a cookbook therapist," meaning don't do the
Mhm.
same thing for every back pain patient, every knee pain patient. So, typically, what happens is, they come in. I have a standard set of paperwork that I give them. I'm very vocal with my patients. I ask them, "What are your goals for therapy? Like, what are you having the most difficulty doing with your day to day life?" And
Mhm.
usually those questions clue me in on how I need to focus my treatment. So even if it's somebody for back pain, sometimes some people have more difficulty walking or standing, whereas some back pain people have more difficulty sitting. So you just have to consider that person's limitation and also include the patient on the treatment approach, because a lot of times patients feel like they don't have a say in their care. By the time they get to us, they've seen a primary care physician, an orthopedic, a neurologist, and just kind of been gone through the meal. And they just like, okay, I just need some relief. So they're frustrated. And so I want to hear, what do you want to be able to do? What are your goals? What are your thoughts about therapy? And a lot of times when you center and integrate your care around the patient, it gives them a lot of assurance that you're going to address what needs to be addressed, and they see how it directly correlates with their daily life. So that's how I kind of integrate that individualized approach, because there's no one person that comes in the same with the same set of functional limitations. So you have to definitely, and then you always reassess. So every time, so say they see you for 4 weeks,
Hmm.
I'm not doing the same thing from visit one that I'm doing on visit three. Every time they come in, I'm constantly reassessing, like range of motion. If it's a back, I'm checking their movements, their motor movements, their functional movements, like squats. How are you doing with sleeping? Like all these things related to daily function. And I adjust the treatment, because that way you get a whole treatment approach versus just honing in on one body part and just trying to strengthen it. Like it's not really as realistic as it once thought to be.
Absolutely. And before we get to, I know you're a good friend there, Keisha Newell's question. Look, I want everybody to know that we were going to have this episode several months ago, and unfortunately, the good doctor here had fallen ill. And so we want to also say that we're so glad that you've made a speedy recovery since that time, that God has blessed you. And so we're also glad to have you, and we're glad that we can make this happen. So let's go to Keisha Newell's question. Let's see. Do you have to have a prescription or a referral form from a medical doctor to come and see a physical therapist? Great question.
So, of course, this is going to vary state to state, but in the state of Mississippi, to give you full understanding, yes, you do have to have a referral to see a physical therapist, because we do fall under medicine model. However, you can have a referral from a medical doctor, a nurse practitioner, an osteopath, a chiropractor, or a dentist. So any of those providers can refer you to therapy, just because those are our practice guidelines in the state of Mississippi. Yes.
Awesome. Awesome. All right. So Jasmine's got a question here. Any advice? I told you she's always going to relate it to fluid. So Jasmine, are you asking any advice on fluid retention from like does Dr. Robinson work with patients who are having issues with fluid retention? I guess that's what she's saying.
Okay. So I'm thinking, like, like people that suffer from lymphedema
Yeah.
and all that kind of stuff. So you got, and now it's so many specialists out there for lymphedema now. But from a therapist standpoint, how to address fluid retention, a lot of times we do the compression wrapping, dosage of exercise, and of course you have to tailor it to a person, because you don't want to do too much, because too much can add to it. Educating the patient on sustained postures, like if they're going to be sitting in gravity dependent positions, they need to elevate their extremities. And then sometimes they do have to go see lymphatic specialists. There are some PTs, OTs, and other professions that do lymphedema, where you're correlating a team approach with them as well. And
Mhm.
nutrition's a big part of it. Limiting a lot of like sodium, processed foods, and all those kind of things.
Well, I'm glad you touched on that because my mother is watching now, and so she's been suffering from chronic back pain. I need to bring her to see you because her orthopedic surgeon, she's had three back fusions: L3, L4,
Mhm.
L4, L5, and L5 S1. They did the traditional, like a midline incision on the back, a posterior approach. The next surgery she had was the lateral approach over at River Oaks. And then she had a L5S1 anterior approach fusion, and they put that little cage device in there. Then she also had to have a decompression surgery. So she's had three fusions and a decompression, and over the age of 80 years. So she just had terrible time, got like multi-level spinal stenosis. She's got bone spurs, bad arthritis, bilateral, knee, bone on bone, like a slight torn meniscus. So we've got a whole lot of things. Do you feel like, from your experience, that there are also treatment programs and modalities that you deal with that could even help patients this complicated?
Yes, for sure. I once worked for a company that saw a lot of complex chronic pain. That kind of respectfully describes your mom. I'm sorry she had to deal with so many surgeries. That's a lot to go through. I mean, one fusion alone is enough, and
Yeah.
times three, and then plus a decompression. So you think about all of that. Abdominal and posterior trauma to the torso. I have seen great outcomes with a lot of patients who've been in chronic pain for so long. A lot of times it takes a little bit longer, a little bit more therapy, and you have to tailor the tolerance to the person. Um, I wouldn't say that it's a lost cause, but it would definitely be a more detailed exam. And sometimes you have to, because of the fusions offer the maximum stability to the back. So once you have a fusion, essentially that particular vertebra vertebral level is not moving, like it's maximum stability. So what happens is you'll see hypermobilities above the level of the fusion or below. So
Mm.
sometimes you have to look at the thoracic spine, the upper back. You have to look at the hips. So there are other things that you can address outside of what's already been surgically done or whatever to try to get the patient some relief. But it's definitely worth a shot for a therapist that's doing back to that whole patient treatment approach and not just honing in on the back. You got to look at the whole like body system, like the hips is and the thoracic. And a lot of times with those fusions, if it's been a lot of fusions in the lumbar spine, if you address the thoracic and the hips, they'll get some relief too, because you can see weakness and different cross syndromes there too that's worth addressing.
That's right. That's my mom. We put her comment up. That's my mom right there. So I hope you heard the response. And also, I don't know if you missed it, but she also talked about processed foods, because I told her eating grits, microwave grits every morning, and even though it's turkey sausage and not pork, that's no type of nutrition. And so maybe if you could just help us focus on that for patients like her, that the nutrition is so important.
Yeah, and you know, a lot of times it's a marathon and not a sprint when it comes to nutrition, right? But I always tell people to look at the food pyramid. That's the basic guide on how we're supposed to be eating. Um, and I will say defer to a nutritionist too, because I mean, yes, I touch on nutrition, but that can get really convoluted sometimes, especially living in the South. But
Oh, yes.
definitely trying to watch the processed foods because there's a lot of sodium and different additives. Trying to stick to like fresh, fruits, vegetables. Water, increasing your water intake helps with overall mobility. Fiber intake. Yeah, but yeah, I would say you know, doctor, so better than I do as far as how it can get complex with nutrition, but definitely trying to limit a lot of processed and salty foods and that like nature is not really good for muscles and joints and things.
Absolutely, absolutely. We'll try to put some information on the food pyramid, and just so you guys know, that's something that I know you've probably seen since days in your days in school. And at the top of it, you got fats, oils, and sweets, and the word for the day is sparingly. So it says use sparingly. Then after that, 2 to 3 servings of milk, yogurt, and cheese on the left. We were trying to get the image to put in the chat there, but we weren't able to do it. 2 to 3 servings of milk, yogurt, and cheese, and or 2 to 3 servings meat, poultry, fish, dry beans, eggs, and nuts. And then at the bottom of the pyramid, which is the widest part, 3 to 5 servings, that is vegetable group, and and then 2 to 4 servings of fruit group, both of those, three to five and 2 to 4. And then at the very bottom is the bread, cereal, rice, and pasta, which is 6 to 11 servings. But you have to know that if you're a diabetic, then certainly we want to do less on the carbohydrates, which is coming off of the bread and cereal, the white rice. We want to come off that. But anyway, that's another conversation for another day and time. But the food pyramid, as she said, you heard it first here, folks. That's what we need to be. That's what we need to look at. So, Jasmine, let's see another point here. Massage therapy and postural therapy are highly recommended for maintenance and recovery. All right.
Um, I agree with that. A lot of times I have patients who have met all their goals from a physical therapy standpoint and may just have like a little bit of lagging, like myofascial pain or whatever. And I do refer to massage therapy.
Mm-hmm.
As far as the postural therapy, I'm not quite sure what you meant by that because I can interpret it in so many different ways. But yes, I do think it's important to have a teamwork of other providers that you can refer to once they've kind of maxed your services and may need something else to address their needs.
Okay, awesome. So let's talk about a typical, plan for somebody, let's say recovering from an injury. What would you say like a person could expect? Say someone like my mother who's had these, four surgeries, or maybe somebody who's thrown their shoulder out, or they have frozen shoulder, different things. When they walk in the door, through In Touch physical therapy, what types of things would they expect on day one?
So usually on day one, it's just a very detailed examination, collecting information from the patient on like the nature of their injury. Some people that can't recall it's an insidious onset, and just doing a detailed exam of what's going on, and then really my first day, I try to get my hands on the patient because I don't want them to feel like they're just coming for the exam only because you're doing a lot of moving and poking and prodding in places that hadn't been messed with, and that can increase their pain during the exam. So I want to do something to get their pain down. So I'm going to do some form of manual therapy, which can be um, I know y'all like to say massage therapy. We call it soft tissue mobilization or joint mobilizations, and then integrating modalities to help address pain. And also, education is a big component on the first day because patients have to understand, why do I need this therapy? Why can't I just Google this and do these exercises on Google? Like, what's the difference? So, educating them on just basic exercises tailored specifically to their whatever, if it's stiffness in their back, just some basic gentle stuff where they won't flare themselves up.
Hmm.
Educating them on activity modification the first day is a very big component. A lot of times they come back for the second visit, they're like, oh, I really hurt. And it's not always what we did in therapy, it's what they did between the time they saw me and the second visit. So it's like, if you're a lower back pain patient, I tell them you have to limit the bending, the lifting, the twisting. You can't go mop and vacuum the whole house in one day and then think that you're not going to hurt when you're already flared up. So it's a lot of activity modification and education as it relates to those daily activities.
Hmm.
Not telling them they have to be sedentary, but you definitely have to be intentional about what you do, because when you're highly in a pain phase, it can take anything to just ramp it up even more. So it's definitely just a mixture of all those components. Getting my hands on the patient, educating them, doing a detailed exam, and then just coming up with goals with the patient so they feel like it's worth their time to come, right? Because most of the time people don't come to therapy until it's like, oh, I can't walk no more. That people don't come when they first start experiencing symptoms. It's usually the last resort, and they want to see, okay, is this worth my $10 copay? Is this worth, so it's all of those components that it get that buy-in, they get that trust from the patient that you're real trying your best to help them, and also get them to understand that they are responsible for their care too. It's not a passive approach like, yes, I'm going to help you. I like to say that I'm your guide along the path of healing, but you got work to do too, i.e. home exercises, activity modifications, and whatever else deemed necessary at the time. So
Absolutely. I think I'm glad you mentioned that, you have to do your part. And, one of the interesting things you touched on, a lot of people are saying, well, is it worth my $10? And, one of the things that is probably even slightly frustrating, I would say, even from a primary care standpoint, is a lot of people, when I had my private clinic and everything, and we had $99 plan for individuals, and you can come and see the provider or myself, an unlimited visits for $99 a month. We know that people pay cell phone bills larger than that. We know that they buy all kind of things, whether it's red bottom shoes, going to Beyonce concert. I mean, all kind of things. So, you know, but when it comes to people's health, it's so hard to get them to buy in. And like you said, until they're at that point where they're just so broken down, and they can't even lift their head up. They done had all the fusions. They can't move their neck, and now they're saying, "Oh Lord, Dr. Robinson, help me." So
Hmm.
how do you? I mean, how do you get some of these patients to buy into to what you're doing?
And you're absolutely right. A lot of times, and another caveat to it too is these high deductible plans with therapy where they may have to meet like a $5,000 deductible first before insurance to pay. I always break it down like a car wreck. So, say you was in a car accident, aren't you going to have to pay that $500 deductible before State Farm pay the rest?
That's right.
And of course, I'm a very compassionate therapist. I'm probably not the best business person, but I come up with payment plans and all that kind of stuff to try to overcome those financial limitations. But as it relates to them not just wanting to spend money, period, they have to get them to understand. Listen, you've been in pain for 2 years. It's not going to take one or two visits and you're cured. Like, you got to think about that. Like, it's going to take some intense therapy, and you got to do it, because if you don't, and a lot of them, some of them might want to be avoiding surgery, and I'm like, you want to try the least evasive option first, so it's worth your time to do this. And I give them a time frame. I say, hey, because I'm not the type of therapist that's going to hang on to patients if they're not progressing or getting better, because I'm
Mhm.
always reassessing every time they come in. If
Yes,
after about, depending on what the diagnosis is, of course, I can't just say everybody's going to be 4 weeks or 6 weeks, but say my plan of care typically ranges 4 to 6 weeks, and I reassess and I feel like we've made no progress at all. Okay, let's pivot. Let's get you to another specialist or get you back to the doctor to see what other alternative treatment. So I think that helps to kind of like give them buy-in, because they know, like, I'm not about your money. Like, I really care about trying to get you better. And then when they see on the first visit, when I educate them and I just break things down, just as simple as, hey, don't mop the whole house in one day, or
hmm,
hey, like, look at it like it's 7 days in a week, and if you're only coming to therapy one day a week, you got 6 other days where you're not getting treatment and you're going to be in pain, so it's worth you to come
there you
2 or 3 times a week. So
go. There we
there's
go.
so many ways you have to kind of, it's the truth though, but of course it took time for me to get to that language to where it kind of penetrated to give them that, to get them to buy into their therapy, because at the end of the day, I always tell them, it's your decision. I can't force you to do anything, but you have to be willing, because if you're coming up in here and you're angry, you don't want to do it, you're doing a disservice to yourself and to me.
That's right. Well, look. So I hope that, again, no shade and no tea, but I hope that Dr. Lily James, my wonderful mother, is still watching this episode, because these are the same things, and you know how it is, Doc. When we are, somebody's child or somebody's church member or somebody's relative, it's like, even no matter how blessed we are or good we are, or the good Lord is working through us and blessing our, um, our medical ministry, and you've seen the results in our patients. It's like these people that are related to us or know us personally, they're like, oh, no, they don't. And again, and like I say, it goes back to the thing, to the point you said, where somebody's just broken down and said, well, what am I going to get for $10 copay? Well, it's like, well, you weren't worried about what do I get when you were doing all these other things that messed you up. So don't come in here, and you know what I'm saying. So yeah, sometimes it gets a little difficult to motivate patients, but I mean, I'm glad that you and I have a very similar mindset. Like you said, you're not just going to take people's money. You're there to help folks, but they have to be willing to do their part.
Exactly.
All right, Keisha Newell, let's go. I missed some questions here. I think we see Doc. We've got about what 20 prepared questions. I'm not even on question 4, because see, we've got such great interaction.
It's
All
good
right,
stuff.
that's right, Keisha. Earlier, you spoke on the differences between a physical therapist, a trainer, and a masseuse. But what is the difference between a physical therapist and a chiropractor?
Oh, that's always hard for me to explain, because
Oh, Keisha, good question.
I actually got some great chiropractors in my network, and we refer to each other. So I love chiropractors. I don't like,
Absolutely.
there's a common misconception that PTs don't like chiropractors or vice versa, but I love them, and I think that they are much needed in this healthcare field. Um, I would say a major difference traditionally is, and I don't want to speak ignorantly. I'm just going to give mine from PT perspective. So chiropractors, there are a lot of things that can be addressed through, like, spinal adjustments and healing and that type of thing. So that's more of like their wheelhouse, where a lot of things are centered from the spine. Whereas we, yes, spine and treating the spine is a big part of what we do, but there's so many other, and just like them, but we just treat in a different way. Like, we don't focus on doing like a lot of, I don't want to say that they just, a lot of chiropractors are mixers now. They don't just do adjustments only. They have modality therapies and exercise therapy in their clinic. So it depends on whatever that chiropractor's offering. But traditionally, it just used to be like adjusting the spine to try to, address pain, radiculopathies. Whereas we treat spine, but it's like we rehab injuries. We do the exercise integrated approach. So there are similarities, but the school of thought, as far as, I guess, the methods might be slightly different.
Mhm.
But I was always say you can defer to a chiropractor for more understanding. But we're very similar, but we're very different at the same time. They're natural, holistic practitioners. Um, yeah. So I'm sorry, it's not as easy to
Right,
explain,
right,
because
right,
it can get very convoluted, and I don't want to confuse people. But
right.
uh, yeah, sometimes though, like, patients can do both. Because we might be focusing on something else, we might be focusing on the strengthening component because the patient's weak, and they're just focusing on like addressing the pain in the back with the adjustment. So we can cohesively work together to for the betterment of the patient as well.
Absolutely. And that's, I think it's so important that you touch on that. And that was why we had started the practice. Because for for some strange reason in the medical community, there's so much of this cowboy medicine. Like, well, I'm a this type of surgeon, and I'm the cream of the crop. Then, or you're just a primary care, or I don't. Like you said, a lot of physicians, they don't believe in chiropractic medicine. Whereas my business partner is an excellent chiropractor. So, and then like you said, there's some crossover with some of the things that you guys do with chiropractors, but still everybody's got their own lane, their own wheelhouse, and we just have to work together. Nobody's more important, no specialty more important than one another. We are all there for the betterment and for the good of the patient. And so
Exactly.
yeah. All right, Lauren Lewis, can you talk about prescription I don't know if this is for you or for me. Can you talk about prescription drugs versus doing it the natural way that you're describing? I don't know if you want to touch on that. And I'll touch on the drug part.
Okay. A lot of times, I do see a lot of patients that deal with chronic pain. So, meaning they've been on long term narcotics to address pain, and so sometimes they don't want to stay in that cycle, and they want to try therapy and other, maybe like chiropractic care, to see if it'll address their pain. And so, I have seen some great outcomes. But no patient's the same. But I do think, a lot of patients sometimes just want to see how it goes without doing, like, as it relates to just specifically pain medicines. I'm not speaking on any other, because they don't want to be relying on that for relief, and sometimes they feel like it may mask their progress, that they might be just taking it and they're doing better than what they think. And so sometimes you definitely can, bring in therapy. I do network with a lot of chronic pain doctors too, because sometimes they want patients to try the least invasive approach and kind of come off some of the pain medicines to see if therapy will help. But I do believe in pain medicines for sure. So I'll defer the rest of it to the Dr. Bookhardt.
Okay. Well, I want to give you all some very interesting information here. The death rate in the so first of all, what country has the highest opioid death rates? And that is the United States of America. Now, which is crazy. In addition to the reality that fewer people are using street opioids in some parts of the country, but still it is likely that there will be nearly 100,000 overdose deaths charted in the year 2024. The number was actually 87,000, and previously it was 114,000 in 2023. And so they were at 87,000 when they collected the information in 2024, but they're expecting that when they get the final information and statistics, it'll be nearly 100,000. So when we talk about prescription drugs, like you said, we're talking about a lot about opioids, narcotics, things like fentanyl and hydrocodone, Percocet, stuff like that. And the problem is that so many people come in that they come in. Okay, Percocet, Norco, Tramadol is one of the kind of weak
Breakthrough.
drugs. Yeah, but folks come in and they're expecting this, and they get a little bit of euphoria, a little bit of a high. And so when you just take plain Tylenol or even Tramadol, Ultram, which is not as strong of a drug, if you will, sometimes they'll either complain and say, I'm still having breakthrough pain and things like that. And, again, unfortunately, the prescription drugs, they can certainly help to, knock that pain way down so that you can participate in the physical therapy, things that she's doing, and chiropractors and occupational therapists. But the problem is, like I just talked about, the mortality rate of narcotics. I mean, 100,000 people is ridiculous. So we have got to do our due diligence in trying to educate people and getting them off of these things and doing the long-term maintenance, which is when you go to physical therapy, when you go to chiropractic, they're going to teach you things, because obviously you can't come to Dr. Robinson for the rest of your life, So they want to teach you things to give you the tools, motivate you to be better, to do these things, and hopefully so that you'll have fewer issues with pain. So let's see, let's go. All right, we got a few more. Few more questions. All right, Jasmine. Let's see. So she said, I meant that some people need help being mindful about therapy. And therapy starts with them as well, reminding them reminding them not to roll their shoulders, reminding them not to tuck their pelvis, reminding them hands-on, showing them that you're noticing changes, etc. Okay.
I'm
I
sorry, I
think
didn't see that part, but I was reading. I think I saw her comment earlier about postural therapy. I see what you meant. Yes, I do spend a
yeah,
lot of time educating patients on. In America, we spend a lot of time flex because we're on tablets, we're on phones, so we straining our head. We like this. So I'm trying to get them to get more. You don't have to sit up straight, like
that's
that's
right.
not all the way comfortable, but get more of a neutral spine because as long as you stay in those pop positions or whatever, what happens is the muscles and things on the back end get lengthened out and everything gets shortened here, and then it's hard to get back up erect. So a lot of posture education as it relates to work desks. A lot of people don't have the best ergonomic setup of like people who work mostly sitting. So a lot of education on where the computer should be, where the monitor should be, where the mouse should be, what kind of chair should you be in. All of those play a factor. If you're going to be on your phone, you need to prop it up instead of holding it up if you're dealing with neck pain, back pain. So you're absolutely right, Miss Jasmine. You're dropping a lot of tools in the chat, and I appreciate that.
Yeah, absolutely, absolutely. Looks like my mother says I'm definitely going to get an appointment with you, Dr. Robinson.
Come on down. I'll take care of you.
All right, all right. You got to keep it though. You got to keep the appointment. Okay. Let's see. Do you do pelvic floor therapy?
So Lauren, hey Lauren, thank you for getting on. Yes, I do some pelvic floor, but if it's all external. But if it's something that requires more internal exam, there's a great PT named Veronica Woodson in Flowood that does pelvic floor only, and I refer out. But I do some basic pelvic floor, like I do see pregnant women who deal with back pain, maybe some incontinence, that type of thing. But if they need like that biofeedback machine and internal exams, that's when I refer out, because that's not my wheelhouse as far as like the complex part of pelvic floor therapy, because there's different layers to it for sure.
Absolutely, absolutely. Jasmine, massage therapy
She said
helps.
I go to her. Small world. All right.
Yeah, what I mean, massage therapy helps to activate the natural release of painkillers in the body, drug free. So, look, again, I can't say it enough. Like I said, especially to my own family members and patients alike. Look, and the thing is, once you start people on this, they get hooked on that. They start getting a high from, things that services you offer in the massage therapy. That's why I go to massage therapy when I can. it is so important. But see, we have been so accustomed to being this microwave society that, I want to be pain free right now, so I'm going
Mhm.
to take a drug, and it's just like, then you'll just be hooked on narcotics or marijuana or whatever it is, for the rest of your life. And those things definitely have their place. Marijuana has its place, but
For
you,
sure.
you don't you don't want to just be there sitting there getting high, because when the high or the euphoria wears off, you're still in pain.
Back to square one. Yep.
Uh, let's see. I think
And
that
I do integrate a lot of soft tissue massage therapy with my hands on. So, Miss Jasmine, yes, it's very important. I see great outcomes and it's much needed for sure.
awesome, awesome. We've still got about 10 more minutes here, folks. So please keep, these are excellent questions. We appreciate the participation. I see let's see. So keep them coming. Lauren's got another one.
Oh,
Let's
that's a good question.
is there a mental health connection as it relates to physical therapy? Yeah, great question.
Yes, yes, and yes, for sure. I make it a habit to ask questions as it relates to someone's mental health, especially on the first day. If they have a lot of times trauma can manifest physiologically as well as mentally, so you can tell. And so I'm asking, are you depressed? Do you have anxiety? Do you feel like you're in a dark place more oftentimes than not? Just those key questions. Are you in mental health therapy right now? Maybe you should go. Hey, here's a suggestion of some places you need to go. So yes, it's definitely a network between PTs and mental health professions. And also, when you work with patients and you spend a lot of one-on-one time, on average, I spend 45 minutes to an hour with a patient
Hmm.
one-on-one, and they're going to unpack a lot. And in our program, we took some mental health courses. No, I'm not a skilled mental health therapist, but I do feel like to some degree, when you work in healthcare, you're gonna address it, even if it's just listening, just them having somebody to talk to and giving them guidance on how to, get to somebody that can further help them. It's definitely essential and important. And I say, even for me as a therapist, connecting with my patients is a big part of them feeling like they trust you as a physical therapist. It's not just, hey, I'm seeing you for my knee pain. It's like you really listen to me and you're talking to me, and so that's important. But you also have to know when it's time to refer them to a specialist, because you don't want things to get swept under the rug. And mental health is a big component of what we do. And so sometimes when they start, that counseling or mental health therapy, that also can address chronic pain too, because there's a lot of similarities with chronic pain, depression, anxiety, fibromyalgia, a lot of those different global diagnoses that take a holistic team approach and not just one particular discipline.
Absolutely. Man, we've got time for a few more. And I see that we have a Miss Sheila Barkley from my home church at Mount Sinai in Orlando, Florida, Mount Sinai SDA Church. So this she would be a new. Well, I don't know. Maybe this is just your first time asking a question on the show, but welcome, and welcome to all of our other new viewers. Thank you all for staying on with us. And again, as you see, that we are having an amazing conversation. So keep your questions, comments rolling. So let's go. Before we go to Miss Sheila Barkley, my mother says she has a question. Does physical therapy help to rid the body of painful inflammation?
Yes, ma'am. It certainly does. Especially like if it's, well, I would say acute inflammation and chronic, because like we do, massage therapy, soft tissue stuff can help with painful inflammation. Different modalities, cryotherapy, wrapping, elevation, all that type of things. And it also could be more of a teamwork approach too, with partnering with other providers to address inflammation if PT alone is not helping to decrease it over a certain period of time.
Absolutely, and I think that's a great answer. And then, as well, in terms of inflammation, I think your question is spot on, and that's why, like she said, we have to work together. We can use medical therapy with things like anti-inflammatories, provided that your kidney function can tolerate, that you don't have any stomach ulcers, things like that. So the medical side, we want to clear you for that, and I use drugs like meloxicam, like which Mobic, which is a gentle anti-inflammatory that will actually work on that pathway with cyclooxygenase and all that other stuff, the way that those NSAID type drugs work. NSAIDs are, things like ibuprofen, ibuprofen, aspirin, those kind of, Tylenol is not an NSAID. So Tylenol is not an anti-inflammatory. Ibuprofen is. And so those are the things that we would work on the medical side. But then also, again, for long term, you want to go to physical therapy, occupational therapy, and then in terms of the inflammation and really releasing certain things like myofascial release and stuff like that, people like Jasmine Briscoe come in because they can work on, that's going to be a long-term thing, going to massage therapy every week or every 2 weeks. So all those together, Mom, are going to help with painful inflammation. All right, Miss Sheila Barkley. Again, glad to have you on. This is quite a surprise. Does physical therapy really help neuropathy?
Yes, ma'am. I love treating neuropathy because uh you can really see a reversal. So you can see like neuropathies as it relates to the neck, like they're having numbness, tingling, pain going down the arms, or as it relates to lumbar pain going down the leg. We have different hands-on stuff that we can do to address that. A lot of times it's flossing the nerve. It can be more complex as far as the language of it. But yes, ma'am, I have treated hundreds of patients who've had neuropathies that have gotten better. But I would say the only one that's a little challenging is diabetic neuropathy because it's
Hmm.
more of a systemic issue.
Hmm.
We can try to address, some of the distal stuff, but it just gets kind of tricky because it's systemic neuropathy. But like the mechanical ones, like cervical, neck neuropathy, lumbar neuropathy, that type of thing responds really well to physical therapy. And Miss Jasmine, yes, I love what I do. This is my calling. It's my ministry for sure.
Awesome. And that truly makes a difference, when this is something like you said that you view it as a ministry. And that's one thing that I know we joke around sometimes and when I see you and stuff, but that's one thing I'll be honest with you that I did, saw in you. And that's what I wanted to have you on the show, because not just because you're somebody who's black, or, you know what I mean? Because I know some people that unfortunately are black and they ain't no good, So it had nothing to do. You happen to be black, and that's great. But the main thing for me is so hard to find people that are truly, not only are they good at what they do or gifted at what they do, but they care about people,
Yeah.
and that's something that's truly missing, you know what I mean? In this art form, like we are so ready to say, well, how many patients do I need to see to, make a bonus? And it's not about that. But don't let me get on my soapbox. Um, let's see. I think I got caught up on all the question. And neuropathy, going back to Sister Barkley, like she was saying, it is challenging with diabetic neuropathy. There are certainly other things. So things like gabapentin and Lyrica and all that. But you want to be careful with all that stuff because it just turns, again, just like narcotics, it turns people like into, just lethargic folks who just end up getting hooked on that stuff and then just, end up becoming sometimes, unfortunately, drug addicts. And so it's very difficult to treat that, but it can be done. And there are some things that, and also even the chiropractors use, and you may use it too. These devices that you put on the floor and they kind of vibrate and give these electrical pulses, almost similar to a TENS unit, and you can put your feet on them. And so, uh,
Mm.
yeah, those are helpful. And Keisha's asking what exactly is neuropathy. So that, Keisha, that's that feeling when people talk about pins and needles, numbness and tingling. And so, especially with diabetics, they get what we call a peripheral neuropathy, meaning that there's so the, fingers and all that, especially the feet. So that's why when you do a pin prick examination, you take a pin, you know, and I say if I were to just jab that into your foot and do like that, a person who's a really bad diabetic who has bad neuropathy, they might not even feel it. And so that's the harm with diabetics and people who have bad neuropathy. That if they can't feel a pinprick, well, they might be going around stepping on glass and nails and all that, and they end up with tetanus and other infections. So, yeah. 7:50. Do you have a few more minutes, Dr. Robinson? About 5, 6 more minutes to hang
Yes.
with? Okay, I know this is, we tend to go over a little bit, and this has been quite an amazing episode. Like I said, I was on question. I haven't gotten to question number 4, and that's great. We're okay, awesome. All right, perfect. Let's see. I think we're all caught up with our questions there. Let me go back. I think I'll skip that question. Um, one of the questions that we had was, what advice do you have for people to stay motivated, and consistent with physical therapy exercises outside of the session?
Get them to understand that it's a requirement. They are obligated to do it, because if they don't, you're hitting the reset button. How I explain it is, if you're not doing your part in between sessions and you're just looking to therapy to be pain free, then you're hitting the reset button every time you come in here, because there's no carryover from session to session. You can tell when people don't not doing their exercise, because a lot of times they're not getting better.
Mm,
So just
mm,
getting them to understand how important it is with helping with whatever that ailment, whatever that condition is, and them wanting to be in longer duration pain relief and not just short duration. So just kind of breaking it down more so that way to keep them motivated. And also I always constantly go over it. I'm fine tuning their home exercise. I'm adding something, taking away something.
mm,
Sometimes people don't want the mundaneness of doing the same thing, and you have to, as the therapy sessions progress, the home exercises progress. So it's always a remix, I like to call. And so that keeps things interested, and that gives them more apt to be compliant with their home exercises.
Absolutely. Absolutely. I just want to put that caption up there. You can tell when people are not exercising because they're not getting better. We had to put that caption up there. We had to put that up there.
We'll get that put on the t-shirt.
We got to put that. We got to put on a t-shirt. I think we're caught up again. You know, um, and while if you guys want to get maybe 1 or 2 more questions together, I would love to give you the floor, as we do each and every episode, to let everybody know again who you are, where your clinic is located, how they can get in touch with you, and what you're offering. And hey, if you're offering any specials, I don't know, 2 for 1. I mean, I don't know.
I got you. My name's Sharmon Robinson. My clinic is In Touch Physical Therapy. It's located on Lakeland Drive. I like to say I'm on the Jackson side of Lakeland, so you do not have to cross the bridge into Flowood. Right when you pass Smithfield Stadiums, I'm directly behind the Shell gas station and where the little baseball field is. I have socials. You can follow me on Instagram and Facebook. In Touch PT 601 is the tag for Instagram and Facebook. You can go to my website, www.intouchphysicaltherapyms.com. You can find me personally on Facebook or Instagram. I have personal pages, and my business stuff is integrated on there. I accept new patients. I do free consultations. So the difference between a consultation and an initial evaluation is that the consultation is about 20 minutes. It's just a mini quick exam, mini screening to see if you're a good candidate for therapy, because some people don't know if they need it or not. And I'll be honest with you. I'll be like, okay, you don't really need it, and I'll give you some exercises free of charge. You go on about your way. But I do free consultations that's about 20 minutes in nature, just fitting those in throughout my day. So that could be a good way to see if you need it. Typically I can get new patients in within 24 to 48 hours,
Mm,
sometimes same day, depending on how the insurance parameters work. So there are a lot of other PC places, like big McDonald's style places that have wait lists 2 weeks, 3 weeks. I don't have that. You can call me on Monday and get in on Tuesday.
mm,
Um, and I'm gonna do, if I can't provide the service that you need, I know somebody who you might need to see. So if it's not me and other people, I'm not above myself to refer out to specialists or whatever, refer back to doctor if there's something. That's another thing, PTs, when they transition it to doctorate, is because we become more autonomous, meaning that we recognize things with the body. If there's something going on, I had a patient one time, he was exhibiting signs of Parkinson's. Let's
Mm,
go and get you this neurologist referral so we can see if, and it's exactly what he had. So
wow.
it's not just addressing them from a rehabilitative standpoint, it's getting them to the providers they need so they can ultimately live their best lives. And that's what's important to me, because sometimes it doesn't always stop at physical therapy. Sometimes people don't get better and there are other things going on, and we are trained professionals to notice, hey, they need some kind of testing because they might be exhibiting some kind of autoimmune disease or whatever. So, but yes, Sharmon Robinson, In Touch Physical Therapy. All you need is a touch. Facebook, Instagram, all that.
Awesome. Henrietta says, good show tonight. Well, thank you for watching. Um, and that's one thing I'd like to piggyback on the point you made. I don't know if you felt the same in your in all of your training, but in med school and even residency, for some reason, a lot of people. I don't know why it is in the medical community. Maybe because it's competitive in school, but for some reason, it's like people want to act like they always have all the answers, and that, like you said, it's you don't feel like things are above you to refer out. I don't know if you feel the same way, but I know in med school and residency, people, it's like they sometimes have to act like they just have all the answers and just want to know they want to show like they just have it all and under control. And to me, that's always been a dangerous person. That's a dangerous provider because somebody can either get hurt or killed. With that, you have to know when something is completely out of your scope. Like you said, a patient isn't getting better, you have no problem saying, well, maybe you may need somebody else. And then on the primary care side, there's a whole lot of things that we do. But hey, if you need a heart cath, I can't do a heart cath on you. So I'm gonna send you to a great cardiologist. So But anyway, I'm so glad to hear you say that, because again, so many colleagues were, it's like in school they didn't want to ask questions, and I said, look, I know good and well that you all didn't understand what was just presented in this class. So it's just, it's crazy that, people think that asking questions or referring makes you seem like less than. But
Inadequate.
actually,
No,
it's the opposite.
no, no.
Keisha says, great job. Let's take this question. I think we might have time for if one more question comes in after Shawnee's, we'll take it. All right. What type of exercises should a patient practice if they're diabetic and on dialysis?
That's a from my standpoint, I would say, Miss Copeland, it's not a straightforward question because once
Yeah,
again, no, that two diabetics are the same. No two people die on dialysis are the same. So it just depends on that person's activity level, what the impairments are. So unfortunately, I just can't say these set of exercise work for this, but that's when you need to partner with a skilled physical therapist and see what could work. There are also home health physical therapists too that can come to patients who are dialyzed at home or who aren't as mobile to get to a clinic, like in my case. So there's that option as well, and they're good resources for guiding exercises for that type of thing.
absolutely. Yeah, the great points. And you know, I think that if somebody's diabetic, it just kind of depends, right? So like if somebody's diabetic, but they're a new diabetic and their A1C is only like 6.8 or 7. So, that's really not that bad. They just barely have diabetes. So that may not be impacting them versus somebody with an A1C of 13 or 14 who has, profound neuropathy and they can't feel their feet at all. So, that person is not going to be able to do as much exercise when it comes to being on their feet and things like that, or cycling. And then when it comes to dialysis, like she was saying, there's different types of dialysis: peritoneal dialysis, which is in the belly; hemodialysis, which is traditional dialysis, and right here in the arm with a fistula or a graft. Those people normally go to the center 3 days a week, but they also have home dialysis. So, like she was saying, you can have excellent therapy at home 3 days a week. Maybe the days that you're not having, because a lot of people have dialysis and they feel really fatigued, afterwards. So they may not feel like seeing a therapist those days. They just want to, get some rest. So, I think that those will be the options, but like I say, just really, like you said, depends on the person. They, even with those comorbidities, they may be able to still go to a clinic like In Touch, or they still may be able to go to the local therapy center or the hospital or whatever to have their treatments. But if they're more so a severe diabetic with maybe an amputated foot or amputated leg, those type of people who are not as mobile, maybe they would benefit from having services at home. So
Excellent.
let's see. All right. Well, I think we'll call it there. You have any other points to add, Dr. Robinson?
I just want to say, motion is lotion. People keep moving. Don't be sedentary. Get off these Netflix and
I like that.
chill and binge watching. Your body was made to move, so let's move. Okay, let's get it. In Touch Physical Therapy. All you need is a touch.
You came up with that? Motion is lotion. Is that a
Oh no, my professor said that back when I was in graduate school, so they just kind of
really?
stuck with me. But it does it, moving helps to lubricate our joints, keep us mobile. So yes, as best as you can, try to maintain some form of activity tailored to your tolerance. That's the best thing I can tell people. And no, you don't have to do 50 million crunches or push-ups. You can do exercise sitting in a chair, but motion is lotion. Keep moving, people. Our bodies were made to move, not to sit and just be sedentary for hours on a time. So
You heard it there, folks. I hope my wonderful mother is listening, because I tell you, this is yet another thing that I continue to preach. But we'll leave it there. We really appreciate you coming on, Dr. Robinson. I hope that you've enjoyed it, because we definitely have. So thank you.
I have. Thank you.
Let's give it up for Dr. Robinson, everybody. Wonderful. Well, look, everybody, and thank you to our wonderful audience and some of our newcomers. We had excellent audience participation. Thank you for watching another episode of Telehealth Tuesday. Again, I'm your host, Dr. Michael Bookhardt. We were joined by Dr. Sharmon Robinson, DPT of In Touch Physical Therapy. As always, we love the fantastic audience participation each and every week. Now, before you go, next week, we're going to have Dr. Christina Gladney. You don't want to miss this young lady. She is a jack of all trades and master of basically all of them. She is an expert in nutrition and fitness, wellness. I mean, anything you can think of, she's basically got the answer. Amazing young lady. You don't want to miss it. So with that said, we hope that you will join us next week on Tuesday, 7 p.m. Central Standard Time. Always bring a friend with you. And don't forget to subscribe to Dr. B TV on YouTube. And look, by the way, send us a message. You can DM us if there's anybody that you want us to interview, or if you want to be on the show. We would love to hear from you. If you have a story or testimony or any situation you'd like to discuss, we're here for you, and we'd love to feature you. So God willing, we'll see you always on a Tuesday. This is the place we treat and discuss mind, body, and soul. And remember, of all, true wealth begins with good health. Bye for now. Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health.